Complication, right?
Yeah, I guess I had 2 little complications. So
Well, we like little, but yeah.
So I had the air bubble, like the gas air bubble, and that was deep in my chest and in my shoulder. And the best thing I could say about doing your research is that one of my contacts was talking about the pain he had in his shoulder. So first off was, okay, I know this is normal. Didn't give me a pause for concern at all.
And maybe let me correct you or say something different. I wouldn't say exactly normal, but it's something that can happen. We didn't like it to happen, but it's not particularly dangerous.
Right, so it's something that could happen, but it's not off the radar.
Right, it's not something that means suddenly that there's a big, dangerous, important tragedy that we have to operate on or do something about. It's within the spectrum of the events that can happen with the surgery. We don't like it. We're disappointed that you had this terrible pain, because when we were grading that pain, it was pretty severe, wasn't it?
I would say, well, the bubble pain was always on about a 3 or a 4.
Not too bad.
When I swallowed, I went past a 10. Above
10.
Yeah.
Right. And we kind of grade pain. Kind of one is like a little paper cut, or you stubbed your toe, or your friend in school who's sitting at a desk next to you pinches you or something like that. And a 10 is you're run over by a bus, you're shot with a gun, or something really a terrible
pain.
Like
it brought me to tears.
Right.
And you push it back, and I just lay in my bed, and then in about 5 minutes I'd be back down to a 3 or 4. So knowing that it would go away helped get you through it.
Right. Well, I think we started off a little bit early without maybe to introduce you. You are, just use your first name.
Oh, Tracy.
Tracy from Canada.
Canada.
A.
Right.
Okay. Good. Okay. And you had surgery last Wednesday.
Yes.
And you were second.
I was second.
Second case. And we had 3 other people along with you who did pretty well. But you have this terrible pain that was really serious at times, and then sometimes it would be easy, not too bad. And you mentioned something that we hear a lot that I'd like to comment on if it's okay, and that is you said you had the bubble pain. And you use the word bubble.
Well, that's how they worded it. So
right, the nurses on the floor often use this. They say it's a bubble of gas, right?
Air, gas, yeah.
Air and gas. And we'd like to say, just for the video, it's really not gas. It felt like gas.
It was pressure, so I didn't know what it felt like.
Right. But what it really is that the surgery itself involves cutting and crushing and stapling the stomach. And the pain is when that raw, stapled edge, along with any blood that's in there, rubs across one of the sensory nerves. And that hurts. And for convenience sake, everybody on the floor and nurses and patients, when they talk about it, they say, oh, I had the gas pain, or you said the bubble being a kind of something filled with air, kind of like a gas or something like that. So we hear that a lot, but just as a reminder for those who are listening and thinking about it, and we have a visitor this morning, what we'd like to say is it feels like gas. People refer to it as gas, but there is no gas in there.
Okay, because the nurses kept saying, you got to pass it through you.
Right. They're wonderful nurses, but they're not passing any gas to get rid of this pain.
Okay.
What you need is for some character to stop stabbing you with a knife, crushing your stomach and cutting and stapling it. That's what hurts. And what's remarkable is not that you had some pain with that, because imagine we crushed and stapled and cut on the tip of your finger. You could envision in your mind that would really hurt. Well, in the same way, we expect that you can have some pain from this. We're not surprised you had it. We feel bad about it. What's surprising is that most of you don't have the pain. So it's pretty remarkable.
That's what you said to me on the phone. Like,
yeah.
I'm how you're supposed to feel. Those people are.
Well, it depends. And here's the big difference. And we use this analogy. If you hit your elbow against the wall, a lot of times it doesn't hurt very much. But if you hit right on that funny bone, the ulnar nerve, then you can get a lot of pain. And so in your case, what we would say is, since you have more pain, that the cutting and stapling and sewing is near a nerve, so that you can feel it more than, say, some of our other patients. So we kept you in the hospital an extra 2 days.
Till Saturday.
Till Saturday from Wednesday, and gave you some pain medicine.
Lots.
And we also measured your pulse rate and your white blood cell count and all those things. And basically, they helped us understand that basically you were doing pretty well. We didn't see you do as well as we would like, but we also didn't find anything scary or dangerous or worrisome. There are findings along with pain that make us more worried. And I think one of the things, and correct me if I'm wrong, is over those 2 extra days in the hospital, you gradually improved.
Oh, for sure. And part of it, knowing that, in talking to you, that it was just like a tender area as opposed to something complicated, helped my mental. So I was just able to relax and calm and just take the time to get better.
And use the pain medicine. That's kind of a hint if you, I think, want to pass on to those people. What if somebody's stuck in your situation? Do you have any advice to them to get through it?
Well, take it when you need it. And then near the end, I was asking not to take it because I wanted to know whether I was still in pain or not. Because it wasn't as bad because they took my IV out, so my button was gone, but the port was still there, so they would inject me. And I did that more in the nighttime to sleep.
Sure.
And as it got a little bit better, I didn't want to still keep being medicated because I needed to know where I was on the pain scale.
At some point, you have to cut back on the pain medicine because we use a powerful narcotic pain medicine called Dilaudid, and at some point, the pain should get better. When it does, that's when we can stop giving you the narcotics, stop keeping you in the hospital, and let you go home.
And the other thing, I think I tried, in my mind I had like yogurt, get the yogurt in you, it's all the bacteria, and when I finally threw it up, it had just been laying there. And when I started the soup and the warm, I started feeling so much better. And I asked the nurse for some green tea, and she says, "Oh, we don't have it up here, but I'll order it." And within 20 minutes, I had a cup of green tea, and they've got it marked MBG up in the ward now.
Oh,
so if anyone wants green tea, it's there.
Good job. Would you care to comment on the nurses in the hospital? They do okay?
It was bar none. I mean, it was amazing, and it was great having nurses who had the surgery. Because even the next day, there was no nurses on my day that were post-op or patients. Another one came in from another floor just to talk to me, and she was talking to me about the salt and seeing how I was feeling that day and saying, you know, I felt this way too, not as bad as you, but I did feel this way. And they were just so nice, and the board, like the times, like every hour they come in and check on you, and then the nurse's aide, and after Kelly left, I had a flow of people going in and out of that bed. It was the weirdest thing I've ever seen. But so I was the good patient in the room, so I got good help. Yep, they were great. They were really great.
So then you went home. You suffered this complication, which was pain. And again, we think the pain is a kind of a natural response to major surgery. We're disappointed that you had it, but it's not surprising.
And then you gave me that cocktail of
right, we sure did.
Lovely little.
All right, we give you.
You know what? If they weren't standing there making you drink it, you wouldn't want it.
But that helped gradually the swallowing improve.
Yes, because I couldn't swallow. So to force myself to drink 4 little cups of stuff was bad.
That's tough.
But after that.
And the idea there is when you can't swallow, you worry about the possibility of 2 things. One is that when we're sewing, we've actually sewn it too tight. In other words, if you think about it, you can darn a sock, you can weld some pipes together, things like that. You could do this, and every time you do that connection, you have the risk of making it too tight. So one of the things is when we're stitching or sewing, we could make it so tight it's just not going to open up. We usually try to prevent that by placing a plastic tube across the connection temporarily while we're doing the surgery. So we place a plastic tube a little bit bigger than the size of your thumb. Sandy? We put a plastic tube across the connection, that what's called the anastomosis, and then we sew over that as a guide. And we did that in your case, as we do in all of our cases, so when we took it out, if then you feel like you can't swallow, how can we explain that? Because we sewed it over a guide. And the answer is that when we sew it, we're actually sewing on live human tissue. And so we put needles in and stitch and things like that. It has the possibility it could swell. That's called edema or swelling at the connection. So sometimes we do have people, just like you say, who have trouble swallowing and can have swelling from that connection. So the medicines that we gave you when you told me that you were having trouble swallowing are anti-swelling medicines. So if you go to the emergency department with a bee sting and you have swelling, you may know that they'll give you Benadryl and epinephrine and a bunch of different medicines for swelling. And we did the same thing. We gave you some anti-swelling medicines. And after you got those medicines, Did you feel a little bit better?
Oh, yes, yes.
And so if we had actually sewn it shut by mistake, put a stitch in the wrong place and it was actually closed, the anti-swelling medicines wouldn't make it better. But because we thought it was swelling, then we gave you anti-swelling medicines, and since it got better after that, it suggests that one of the problems with your surgery was you had a touch more swelling than, say, the average person that we have.
And then eating the yogurt just, I think, totally blocked it, because once that came back up, then I was on the road.
Kind of got better. Now, since you have gone home, how was the rest of your week? Can you give us a little?
Oh, good.
Yeah.
Tired. I think if I was at home, I would just stay in bed on the couch. But since I'm here, we've been making the most of it. So we went to the strip yesterday, and we were there for probably at least 6 hours, 7 hours.
Wow. Okay.
Yeah.
It's a lot too long.
Too long, yeah. We've been shopping.
We appreciate the taxes. Thank you.
Yeah,
Big shopping. Our economy.
Yeah, we've been doing it all.
Contributing to the U.S. economy, helping us restart. Thank you for our friends from Canada.
Yeah. So I feel like a core tired, like inside tired, but pushing myself.
Good. Now let us explain to everybody. We often get this feeling of tiredness, and it's always too little salt.
I've been doing lots of salt.
Well, it's not enough.
Okay.
So you need more. And
so I said yesterday, we were sitting on the strip waiting. I said, whoever thought I'd be sitting on the strip here sucking salt pads back? Yeah, I just find it just the salt packets just keep downing them, because you can lick crackers till the cows come home, but you need.
And Gatorade and soup are also good choices.
Yep.
And you can carry the soup with you. It's also pretty salty, so that can help. Overall, though, you've improved pretty much every day. Is that right? You look kind of like you're perking along. You're swallowing okay now.
Oh, yeah.
So there was a period where she couldn't swallow, and now she can. And obviously, we haven't changed the stitches, so that means that there was something transient. It was closed, and now it's open. And you can think that's a perfect explanation, a perfect expectation for
somebody. And I
somebody.
don't feel the pressure.
Right. In other words, the swelling has gone down. The roadblock has opened up.
And I'm eating yogurt, like eating the yogurt back in the room.
Good. Is it okay if we take your staples out?
Sure.
You want to take them out on TV for the whole world to see or not?
Doesn't matter.
All right. You just stay right there. Do you have your little staple remover?
Oh, yeah.
Mama, any questions that you have for us?
Just enjoying this.
Until on that side. So my surgery was fast. You said my surgery was 30 minutes, and I had 7 days.
Yeah, something like that. That sounds familiar.
But because I was in so long, they never took that big bandage off until I went home. I'm like gummy stuff. I can't get off.
Okay, it'll come.
I'll wait till I have a bath.
Okay, so good stuff.
Yeah,
Oh my goodness, it looks gorgeous.
Oh yeah.
Yeah, no, seriously, the wounds look spectacular.
See, I kept watching people and think, how do they not feel it? But you don't feel it.
No?
No. I figure everyone should I wanted to scream just to freak them out. She's not going to scream just to freak them out. But you don't even feel it.
I've been showing my tummy to everyone.
Applause.
Congratulations. Good job. Got a great smile.
Okay. Well, so now we got a good complication to put up on the internet, so hopefully people will